Two more cases of the Omicron BA.5 subvariant have been detected in New Zealand, taking the total to 3. All have recently arrived in the country, having travelled from South Africa. COVID cases continue to decline. There were just over 6,400 new infections reported today. That's a drop of over 1,000 from last Monday. 2 people have died with the virus, both men aged in their 80s. It brings our total death toll to 862. 368 people are battling the virus in hospital, 18 are in ICU or a high dependency unit. And with the arrival of new subvariants and the risk of reinfections, the government's made its strongest hint yet of a 4th vaccine dose. Here's our health correspondent, Lucy Warhurst.
Our borders are open to travellers and to new variants of COVID. 3 people recently arriving from South Africa have now been confirmed to have the latest Omicron subvariant, BA.5. Michael Baker says even if you've had Omicron, you can get it again.
It appears you can get reinfected very easily with Omicron, and it's partly because the different variants or subvariants of this virus, of this variant, actually are succeeding by evading the immunity you already have.
If you've had COVID and someone else in your house gets it, you don't have to isolate for another 3 months, suggesting you're immune.
But it's an arbitrary figure, and it's very clear that some people overseas are getting reinfected within a few weeks.
BA.4 and BA.5 have caused a spike in cases in South Africa, and they could do the same here this winter.
It's difficult to put an exact timescale on that, but it's quite possible it could drive a second wave in the coming months.
And here's why it's important to stay up to date with your vaccines.
Because otherwise, even if you've had COVID before, you're risking getting seriously ill the next time around. And it is likely that most people will become reinfected for a second and even a third time.
Michael Baker says we should be tracking reinfections, and he's calling for a 4th Pfizer shot for those at most risk.
I think we should be really looking at rolling out a 4th dose to the most vulnerable now, because they would have, in many cases, had their full vaccination quite early on, so their level of protection will be declining.
Chris Hipkins says it's not far off.
It is likely that we will have more to say about that in the next week or 2.
3 shots for Omicron could soon become 4 shots for BA.5. Lucy Warhurst, News Hub.